The main difference between the seasonal flu and the new H1N1 is that our usual vaccine that we use every year does not protect against the new virus, the new H1N1. So this year it will be important for people to get vaccinated to both the seasonal flu strains that will be circulating and in fact are already starting to circulate in our area of California, as well as the new H1N1 influenza A. Everyone should get vaccinated both to the seasonal influenza A vaccine, get that vaccine, as well as the new vaccine. It appears that there are plenty of doses of the seasonal flu vaccine, and that doctors' offices and Walgreens drugstores and Safeway and hospitals will all be starting their regular seasonal flu vaccine campaign in October, some of them right away. And we anticipate that some doses of the new vaccine will be available later in October, and then will continue to be available throughout the rest of the fall. The risks of the vaccine are very minimal. First of all, anyone who has a severe allergy to eggs should not receive the vaccine. Secondly, a lot of people are concerned about this neurological disease called Guillain-Barré syndrome, which can be rarely associated with receiving the vaccine. Approximately 1 to 2 out of 1 million people might develop Guillain-Barré syndrome after receiving the vaccine. It's important for people to understand that the vaccine is composed of dead virus particles that cannot cause flu itself. So it's an extremely safe vaccine in that essentially there are minimal side effects. It looks as if the new vaccine against the new strain, H1N1, is going to work with one shot for people over the age of about 17 or over the age of 10 perhaps. So far the early studies suggest that people respond very well to just one dose. Children under the age of 10, I believe, will need to have 2 doses. Well, fortunately, we know that what we saw earlier in the spring, that is that the signs and symptoms of this influenza illness are very similar to our seasonal influenza illness. And we have seen in our country and in the southern hemisphere really no excess numbers of deaths or hospitalizations from this new pandemic strain as compared to our usual seasonal flu, which is very reassuring.